All right, Garrett, first to you. Dr. Bhattacharya, who is he?
Bhattacharya is mostly an academic associated with Stanford University. He came to prominence, as you said, as a proponent of what was then seen as a fringe theory to push for herd immunity during the COVID pandemic, and has since become something of a celebrity figure on the right for his opposition to things like mask and vaccine mandates throughout the course of the pandemic. That's probably the issue that brought him to Donald Trump's attention. But when you look at his biography and the things he studied, it's easy to see where he aligns with Robert F. Kennedy and with a health and human services kind of overall movement that focuses more on things like wellness and on chronic diseases than on communicable diseases like COVID. His biography includes things like broader research interests encompassing the implications of future population health of an aging population, medical spending in developed countries, and measurement of physician performance tied to payment by insurers. If you were going to try to overhaul the federal health systems in this country, that's the kind of background that you might expect. And so you have it here with someone who will have to be Senate confirmed, but for whom I've seen no significant opposition of any kind from the Republicans, who will ultimately decide his fate in front of the Senate probably sometime early next year, Katie.
Dr. Adalja, give us the medical view on this man.
I think that really what you have to address is the fact that he was kind of the architect of what was called the Great Barrington Declaration, which was something that came out in October of 2020, which was arguing against lockdowns, and nobody was happy with lockdowns. But what they were actually offering was this path to herd immunity, which would have lower risk people kind of getting infected, with no mention of testing, no mention of tracing, no mention of using masks, basically just something that would allow the virus to disrupt life even more than it was at that time. And I think that created this false alternative where either you were with the Great Barrington Declaration or you wanted everything shut down forever. And I think what's happened is that people don't realize kind of how intellectually dishonest that declaration was, because there were better ways to do this, like South Korea, like Taiwan. And they basically wanted to be so against the lockdowns that they actually kind of discounted what COVID was doing in terms of disrupting the world. So I don't think that this is a good pick. And I think that this is, he's somebody with really good credentials. But I think his thinking on COVID, and since then he's talked about even withdrawing the FDA licensure for the COVID vaccines, it has really gone to a place where I think, really shouldn't put him in control of the NIH.
That's part of the issue with Donald Trump's first presidency, which I think we might end up seeing again, Mark, is that Donald Trump took one extreme position that forced the other side to take the opposite extreme position, and it just pushed or separated people farther and farther apart and made them more dug in on extreme positions of their own. There was so little room for moderation. When it comes to COVID, in retrospect, there's a lot of talk about whether the lockdowns for as long as they lasted, the masking for as long as it lasted was the best approach. And even Dr. Francis Collins, formerly of the NIH during Trump, was saying that maybe social considerations should have been kept in mind, especially when it came to children and schooling. So when you look at a pick like this and how he came up to prominence, what is the expectation in terms of the general population, the public, for how health policy is going to, I guess, affect the population, how we're going to see our neighbors based on the opinions they hold about, I don't know, getting their kids vaccinated in order to go to school?
Right. I mean, I think a lot of this is predicated on one huge hypothetical that I think we all can agree we hope doesn't come to pass, which is hopefully there will be no pandemic in the next 4 years. Hopefully something like mass masking and school closures and remote learning and social distancing will not be the kind of thing that we have to talk about or even think about over the next few years. Now, obviously, we all know all too well that it's possible. It's happened before. There could be another COVID outbreak of some kind. But I also think it's important to sort of keep perspective and think that even if there were another pandemic, and even if Democrats were still in charge, I mean, I think there's been a lot of retroactive second guessing, or at least trying to sort of keep a more humble approach to where we all might have erred, no matter where we are in the political spectrum or even on the doctor spectrum 4 years ago and 3 years ago to some degree. I think, bottom line, it sounds like a cop-out answer, but the thing about pandemic and public health crises and public health threats is you just don't know what you're dealing with, and every crisis is different, and hopefully we will be able to sort of live without thinking about this, like as we have through most of our history.
Meredith, what you see when you take the choices for health policy in total, when you look at them all together, you look at Mehmet Oz, you look at Kennedy, Dr. Bhattacharya. These are all folks who had staked out a position on COVID in particular, and COVID. Donald Trump sees COVID as kind of a bane of his last administration. It's why he believes he didn't. I don't know if he can say he didn't win, but it's why a lot of people will say that he did not win, even though he's refusing to say he didn't win. What do you read into the choices he's making, specifically on folks who were COVID counter voices?
Well, I think the pattern you're seeing with all of this is these doctors are really people who came to public prominence during the pandemic, and they expressed skepticism about the way the federal government was handling the pandemic and some of the recommendations that they were making. In the case of Dr. Bhattacharya, he was one of the people who said that, forcing people who did not get vaccinated to step away from their jobs or from public life really caused a great harm to public trust in health officials. And with documents like the Great Barrington Declaration and a lot of the skepticism that we saw, especially embraced on the right, people who thought that the government had a lot of overreach, some of these doctors gained a lot of prominence and popularity. And so I think what you're seeing with all of these picks is sort of the residual effects of COVID-19 and the politics around it on public health decisions and how the right viewed the pandemic and a lot of the backlash to the way the government responded.
Yeah, there's one of your colleagues at The Atlantic, Mark, Benjamin Mazur, said this much more eloquently than I just did. He said, revenge of the COVID contrarians. They're angry at the public health establishment. Now they're in control of it. Anger about the government's response to the pandemic swept the COVID contrarians into power. Resentment was their entree into Washington. Now they'll have a chance to fix some genuine systemic problems with the nation's public health establishment. They'll also have the ability to settle scores. So, Dr. Adalja, when you're thinking about settling scores or you're thinking about fixing things, I'm going to go to Dr. Adalja on this. Is there something that you worry about in particular when it comes to settling scores? And then I want to ask you about things that could potentially be fixed.
Well, I think that what's happened is infectious disease is now part of politics, the way so many other things are. So everything is now seen as either this is a Republican policy or Democrat policy, not is this an objective scientific policy. So that's the problem. When you're using infectious disease problems, public health problems to settle scores, then it's going to be like everything else in our life, and that's going to increase distrust among the general public because they're going to say that's how the Republicans view something, that's how the Democrats view something, and no one actually realizes that there's a reality out there, and there are correct ways to do that. And there is a lot of truth to some of the criticisms that happened both during the Trump administration and the Biden administration with COVID. Not enough harm reduction. And I was on your show so many times during the pandemic talking about harm reduction, teaching people how to use tools to navigate a world with COVID. And that's where the discussion should be, but not kind of going to these two opposites that are, again, like, as I said, a false alternative. And I think that's the problem. This is just going to be looked at, as scoring points on the other side rather than actually dealing with a societal problem like infectious disease.
Dr. Ashish Jha has said that Bhattacharya is not, he wouldn't call him fringe. Here's what he says about him. There were times during the pandemic where he took a set of views that were contrary to most people in the public health world, including my own views, but he's fundamentally a very smart, well-qualified person. Are there views of his that I can look at and say I think that he was wrong or they were problematic? Yeah, absolutely. But when you look at his 20 years of work, I think it's hard to call him fringe. I think he's been very much within the mainstream. Are you arguing, Dr. Adalja, that that's changed in the last couple of years?
Well, I don't think that his ideas were fringe. I think, and I don't like the way that they were kind of called fringe and that they weren't publicly debated. I think that Dr. Fauci, Dr. Collins should have publicly debated him and talked about the merits and demerits of the Great Barrington approach instead of kind of ignoring it. That would have been that would have done a lot of good for the general public to see that experts might disagree and that there's a truth to be found. But I think that the idea that he said recently on X to withdraw the FDA licensure of the COVID vaccine, I think that's a little bit beyond the pale for me. But I think that the Great Barrington Declaration is wrong on many different levels, but it should have been something that was publicly debated. And by calling him fringe, like Francis Collins did, it just dug people more in, and we've got all this politics involved in infectious disease again. And I think that's the major problem that we're going to face going forward with the next pandemic, with bird flu, with whatever it is, because now it's a political issue and not a scientific one anymore.